Hi, everybody. My name is Dr. Michael Wald, otherwise known as the Blood Detective. I am a doctor of chiropractic and a board-certified nutritionist, dietitian, and sports nutritionist. I am a life coach and I provide acupuncture. I also did earn my MD diploma, but I do not have an active license, but I use that knowledge to provide you talks just like this. So today's topic is dementia, how to spot dementia before it starts and cut your risk in half. And this is no joke. I would think, and I think it's fair to say that in the United States, if not worldwide, dementia is now of epidemic proportions and medicine is simply failing us in this area. So let's get into it. To begin with, this information is for your educational purposes. It's not meant as a substitute for sound medical or health advice. So I will try to give you some explanations as to why these various signs that I'm going to describe for you, signs of potential dementia in its early stages, are happening. So for example, first I'll start off by saying that early detection of dementia is obviously crucial for effective management and planning. While memory loss is a well-known symptom of dementia, there are several other important signs and symptoms that can indicate the onset of dementia earlier on. And as far as the nutritional remedies go, they work best early. Just like most problems, you want to get them when they're small problems, not big problems. So to begin with, we know that hearing loss could actually be a sign of dementia. Untreated hearing impairment can reduce brain stimulation. So you're not hearing well, you're not getting the stimulation to various centers of the brains, and that can potentially contribute to cognitive decline. Also, a person might have memory loss due to, let's say, neurogenic loss or degeneration of the acoustics nerve or some of the higher brain centers, and that degeneration might be a sign of brain degeneration as well, and thus dementia. Another sign, which is, again, these are all simple to evaluate on a person. Why they're not evaluated used on a regular basis by doctors is beyond me. But weak grip strength, so decreased muscle strength, particularly in the hands, has been linked to an increased risk of dementia. Once again, grip strength is, yes, controlled by muscles, but the muscles get their power, their stimulation from the nervous system. So weak grip strength, weak nervous system, dementia connection. Vision problems, just like hearing problems, poor vision can be associated with cognitive decline, emphasizing the importance of regular eye examinations. So regular eye examinations, musculoskeletal examinations to just check strength and coordination, hearing, all essential as we now all understand. Impaired judgment and decision making, and this can often be very subtle. Experiencing difficulties in making decisions or exhibiting poor judgment can be early indicators of dementia. Again, various brain centers which are involved in judgment and decision making are decaying and even atrophying, which means they're shrinking, which can be an early or even a later sign of dementia. What about personality or mood changes? Noticeable shifts in personality, behavior, mood, such as increased irritability or apathy, may signal early dementia. Once again, brain decay, neurotransmitter problems, inflammation in the brain, lack of blood supply to the brain, oxidative stress to the brain, and other things can result in not just these personality and mood changes, but every other problem that we've just discussed just a moment ago. What about financial mismanagement? And this is a real problem where we have older individuals that are losing their life savings, devastating their lives, the lives of their loved ones, and uncharacteristic financial errors such as missing bill payments or falling victim to scams can be early warning signs of dementia. What about sleep disturbances? Even sleep apnea, by the way. Sleep apnea is characterized by autonomic nervous system dysfunction, a lack of oxygen. That lack of oxygen to the brain causes brain decay, and therefore that can lead to and be a trigger for dementia or a result of dementia. Significant changes in sleep patterns, including fragmented sleep or acting out dreams, have been linked to an increased risk of Alzheimer's dementia. What about repetitive speech? Frequent repeating of questions or statements during conversations can be an early sign of cognitive decline. As is disorientation. Experiencing confusion about time or place, such as getting lost in familiar settings, may indicate early dementia. So it's important, obviously, to have your hearing checked, your eyes looked at, your musculoskeletal strength looked at, and then mini mental exams, as they're called, which help to evaluate various areas of the brain and specifically to identify early dementia, are absolutely essential. And then once we identify someone who has early signs of dementia, they should visit with a neurologist, and the neurologist will let them know of medications that might be in the works that might help. But as I mentioned earlier, I'm not aware of any particularly successful medications, although I hope one day that they will come. So we're left with maximizing the effects of diet. So for example, we know that early dementia is generally responsive to omega-3 fatty acids and another nutrient called GABA, gamma-aminobutyric acid, also magnesium and zinc and proteins. Now, these are just some of the things, some of the nutrients that might help dementia, but each person's dementia, they may have a completely different biochemistry and will need different nutritional and lifestyle adjustments. And also, when we look at the laboratory work, sometimes we'll want to look at heavy metals because toxins can cause dementia. We know that the heavy metal aluminum is the most common environmental cause of Alzheimer's dementia. Someone else might have dementia from blood clots that have caused death of brain tissue, so they might benefit from large amounts of omega-3 fatty acids. So we need to give the right nutrition and the right diet and the right lifestyle suggestions to the right patient at the right time. And then when we look at the lab work, we'll also want to compare a person's blood work. Again, when we're trying to figure out something that's in an early stage, regular clinical ranges of blood, when you've gotten a blood test, cholesterol levels, let's say, there's a range, and that range is called a clinical range. That means you're being compared to the average man or woman who is seemingly well. And if you fall within that range, you're said to be fine. But for example, there are also healthy ranges, which are differently placed blood ranges, and other tests as well. So for example, a doctor might say to someone with early dementia who has a blood cholesterol of, let's say, 160, that that's excellent. Well, they're thinking in terms of cardiovascular risk, and that might be true. It's not always true, but let's say it is true. But the lower one's cholesterol, that is also an independent risk factor for dementia, because the brain is largely composed of cholesterol. So if you don't have enough cholesterol, you won't repair the brain. And the repairing of the brain and also its ability to resiliently resist against inflammation and toxins is called neuroplasticity. You need the right nutrition to do that, and the right nutrition you need to find out. But by reading a person's blood, comparing them to healthy people, as opposed to just clinical ranges or average people, might find things a lot earlier. So if you go to my website at drmichaelwald.com or any podcast platform and search Ask the Blood Detective, there is a few podcasts. One of them is called How to Read Your Own Blood Work. So you'd want to look at that because it will give you a really good education about what the regular blood ranges are, some important ones, not all of them, and what the healthy ranges are. And when you look at those healthy ranges, they would say that 160 cholesterol is not okay, but a regular doctor would never look at it twice. They're also forgetting to read blood work in context with what the patient's having. Yes, cholesterol of 160, let's just say, is good for cardiovascular disease, but it's not good for depression, it's not good for anxiety, and it's not good for dementia, because all of those conditions and other conditions need more cholesterol so the brain is forming well to function well. So I hope that made sense. So thank you all for joining me today. My name is Dr. Michael Wald, and please let me know your thoughts about this presentation, and I hope that you listen to some of the other podcasts and let me know what you'd like to hear as well. See you then.